Got back pain? Back pain impacts 8 out of 10 people at some point in their life. It is prevalent. There are many reasons that it occurs. And I realized I haven't really talked about back pain in almost 3 years in these brief videos that hopefully bring you value every week in your inbox. But I want to talk briefly about some facts behind strategies that work without pills or surgery. I did an extensive Healthy Back series at the local community college. I also provided in my online Have Lifelong Wellbeing Academy to the students who are enrolled there. And I say students, they are mostly people in their anywhere from 50s to 80s, and they enjoy learning and they are determined to have lifelong well-being and age without decline. So they love learning, but I can't go into all of this in these brief videos. I just wanted to share a few important facts because someone had left a message on last week's video asking about bulging discs and whether they could be reversed or prevented. And so I wanted to talk pretty briefly on that because, being an informed healthcare consumer does mean making better choices with improved outcomes. And if you're not informed, your choices are going to be made out of ignorance or fear, which usually isn't the best decision. And it's the number one reason I wrote my books. I want people to be informed. And you can take these out of the library. I'm not even trying to get you to buy anything here. I just want you to know chapter 5 in Pain Culprits, I write about the back pretty extensively, and it does provide a lot of information. But again, being informed. The most important question to ask when you're advised to start a med, change your meds, have a test, undergo a procedure is how effective is it at fixing my problem and what are the risks? This isn't about becoming a medical expert. It's about knowing your pros and cons. And then you can make an informed decision. So I did a mini series on back pain back in July of 2022. And I'm just reminding you, if you didn't see that, or if you did, reminding you that I talked about medical imaging and how very often it is not really showing the factual cause of the pain. Just because something shows up on an image doesn't mean it's the reason the pain is there. So 20 to 25% of people who have no back pain at all have a herniated disc. So that means if you have a herniated disc, it may not be what's causing the pain. Now it might be. Let's not, throw the baby out with the bathwater, but a lot of the times it might not be. And so I want you to view Friday Value video number 55 because that will help you to review and understand a lot of this data. But in the meantime, this is just a reminder. X-rays, CAT scans, MRIs will consistently show all of these things. Bulging herniated discs, subluxations, joint damage, pinched nerves, but they appear unrelated to whether or not someone experiences chronic pain. And there's lots of data to support this. So, disc health, what is that about? I wrote extensively about this in chapter 5 of my book, Pain Culprits, and I want to share more information about this with you. And I will go a little deeper into this next week, but I wanted to be sure that this person had some information. I don't know if this person who wrote has radicular pain, if it goes down their leg. If it is truly disc or herniation issue, Treating Your Own Back, this book by Robin McKenzie is an excellent book. The McKenzie program is extremely successful. If this is the appropriate treatment for you, that book could really help you. Finding an expert, the book is good at telling you if that's a good idea based on, your reading and your response to what you're being told. It does classify you in one of 3 mechanical syndromes. And if you do have a derangement, then treating it will be phenomenally successful. There are also manual techniques, which I'm going to go into next week as well. But for now, I want you to know being informed to move without pain will really help you to resolve the cause and not just relieve the symptoms. I will see you next week.